Hello, everyone. A very good afternoon to all of you. My name is Dr. Gowri Kulkarni, and I head the medical operations at MediBuddy. Today's topic of discussion is something which has been a pressing need in the times of the COVID pandemic. The emotional struggles that we are going around because of the pandemic. It's been a year and a half or more that we have had a drastic change in the way we live, in the way we perceive our surroundings, in the way we are dealing with our physical, mental, social health. It has taken a toll on the way we look forward to life as well, and is the reason that we should all be more aware about our emotional health. We should be more aware and be open to discussing about what it means to go through emotional struggles and what it means for us to perceive it in our environment, in our loved ones, and what is it that we can do if we are having emotional struggles and how we can cope with them. So today's discussion is going to be all about this. Please do bring up your questions if you have any. I'll try my best to answer your questions. But in the meantime, I would want to talk a little bit about what kind of emotional struggles that a lot of people are facing in the current pandemic situation. Now, we all know that last 1.5 years since the time that the COVID-19 infection we have seen, there have been two waves that we have got. Last year was one, this year has been even more difficult. And we have seen a lot of people, near and dear ones. If you ask anyone, either they themselves have suffered with the COVID infection, or they would have someone very dear to them who has suffered from it. Some people have been able to, get out of the infection with good health. Unfortunately, we also have had people who have left us, who've passed away, and it has left a big void, which is very difficult for all of us to fill in the coming years, right? So, with this in mind, it is important to first understand, what are emotions, right? And why do we get these emotional struggles, right? So, from a psychology perspective, emotion is like a complex state of feeling, right? When I say I feel happy, or I feel sad, or I feel angry, or I feel guilty, there could be many feelings that can happen through the day. But emotion is more like a state of, a complex state of all these feelings together, and how it is pervasively present at a given point in time, right? And this definitely is influenced, by a lot of things, including our physical health, our circumstances in which we are, and it does lead to affecting our thoughts and our behaviors, right? So in many ways, emotional well-being will help us to be able to be, to tide through a difficult situation like this pandemic. But now that we have seen this pandemic, it has definitely come into light that health is priority for all of us, right? But most of the times when we talk of health, it's usually the physical health that we talk of, right? That is, right from say the symptoms that we may have physically, or even the say the parameters or the vitals or the biological parameters that would be there, which show that we are in good health, right? But a lot of it in terms of health is hidden, and which has to do a lot more with the mental health, right? Because we really can't see what somebody is feeling, but it is kind of conveyed through their speech, in the way they are able to put through their thoughts, or it is seen in somebody's behavior, right? That is how we are able to see what's happening with the mental health of a particular person, right? Naturally, more focus is now on mental health, because we need to increase our investment in time, and so and even time and money and everything towards our mental health well-being, at not just at an individual level, but at our family levels, at our loved ones level, maybe at a community level, at a workplace level. So I think mental health has been looked at in varied situations in that sense, considering that it is seen to be affected with the pandemic around. Now, what are these mental health issues that we are seeing people coming up with, uh, especially in this COVID era, right? What are these things? Most common that we have seen is definitely a lot more anxiety, right? Um, and a sense of worry about what is going to happen, a sense of fear about the future as to, would I be getting COVID infection? If I get it, what am I going to do about it? Am I going to, get cured? So all of this, the anxiety, worry, and fear, I think is one of the most common mental health issues that we are seeing in the COVID era. The other things that we are also seeing is low moods or depression, right? And with extension of this feeling of being lonely, right? So loneliness, right? A sense of helplessness is also setting in, because a lot of people are feeling, what am I going to do? Nothing seems to be in my control. The uncertainty of the future is leading to a lot of us feeling low and sad, depressed, right? Other symptoms that we have seen very commonly and people do experience are, say, anger, a feeling of anger towards, say, maybe towards a loved one who has left us, unfortunately, or anger could be towards the system or the government, if they are not able to help, anger towards the medical fraternity because of unfortunate, loss in the family. So a lot of more anger is being seen in these difficult times, right? There are a lot of people who are also experiencing things like boredom because they are not able to go out, they're not able to step out, there's no socialization. So a lot of people are also feeling a sense of boredom and loneliness, right? There's another entity called as hypochondriasis, which means that people are very, very anxious about if I am going to have certain health conditions. It is specifically seen in people in the post-COVID recovery phase, where even a small health issue is kind of making them, leading to heightened anxiety about a serious health or health ailment or some issue, wherein it is not so the case. And a lot of people are feeling that they are going to have certain very severe illness and it may lead to even death. So that fear of death is there. So, in a sense, there are a lot of these some different kind of mental health issues and presentations that we are seeing. And it definitely is a struggle for all of us, isn't it? We are going through this day in and day out, and unable. Few people have certain ability to cope with it. Few people may not be able to, and hence it's important for us to first identify if we are having any mental health struggles, right? If you feel that you're feeling anxious more often than not, or worried, or feeling a sense of panic every now and then, or if you are feeling low or sad, or if you're feeling, extreme emotional upheavals, that is extreme anger or extreme sadness, which is presented like, crying spells, it's important that these are identified as possible mental health issues, and we need to take some action to ensure that we are dealing with this, right? Instead of just brushing it under the carpet. A lot of us kind of try to shut our doors and not look at our mental health, but that is not helping in the long run. So it is important that first we are aware of what's happening with us, or we are aware of if it is happening with somebody around us as well, right? So it's important that we take steps to first recognize issues if there are any, right? Now, naturally, when I say about mental health issues and when I say anxiety, it's not that some people may say I feel anxious, but a lot of people do not understand that, is this what they are what they are feeling, it is anxiety, right? So a lot of times it is the symptoms that they present with, and most of these symptoms could be either behavioral changes or a change in the way they think, right? So how would that look like, right? For example, somebody who's low or sad or depressed, they may have a change in their behavior. For example, maybe there'll be a change in their eating patterns, right? So either they're eating too much or eating very little. That could be a sign of something happening there from a mental health perspective. Another symptom could be, say, procrastination, right? Procrastination means trying to push away work or trying to delay something, right? Or not wanting to look at what needs to be done at that point in time. So procrastination can also be a sign of a mental health issue, maybe if where the person may not be able to actually talk about it. Other things could be that a very common symptom, or a sign, or rather a common sign in say low moods or depression could be that a person becomes withdrawn, right? So a person is not wanting to talk to anyone or wants to be away from family, friends, or any activities, right? So that could also be a sign of some mental health issue which is going on. Other things could be, say, excessive mood changes, right? Very high or low, could be also a sign that there's some mental health issue going on. Other things are like sleep issues. I think sleep is one thing where we can talk about sleep, at a length, afterwards, to when we're talking about how we deal with our mental health issues. But I think sleep pattern or change in sleep pattern or sleep issues itself can be a sign of some mental health struggles that a person might be going through. Say somebody who's sleeping a lot, or someone who's not getting adequate sleep, or it could be that there is disturbed sleep, that their sleep is breaking very often. These all can also be signs of certain mental health issues. And it's important that if we are observing any of these signs, we may want to think of, oh, is there a mental health issue that's going on? Are we struggling with our mental health? And do we need to seek any help? I think it's a good idea. Other signs can be things like, inability to cope with day-to-day activities or day-to-day, working, say, in the house or at work. There could be things like extreme fatigue or tiredness, that somebody has got severe physical issues, right, which we call as psychosomatic symptoms. That means people could have severe aches and pains or severe tiredness, low on energy, or aches and pains, like multiple aches and pains in the body, severe issues in the stomach, like digestion issues, can also be sometimes related to certain mental health struggles that one is going through. So I think it's important that we are aware that something like this could be happening, and that a person who's maybe showing these signs could possibly be having a mental health issue, and that they need to be helped, right? They may need to seek help, or we need to offer them some help if we are observing something like this in a loved one. So important is that we open our eyes, ears, our hearts to our surroundings and our people who are in our environment, and look for these. And before doing that, of course, look within and see if you are having any struggles in this manner, right? So please ensure that you are more aware. You try to be more aware about mental health issues. Now, naturally, when we talk about what we can do, right? I mean, there's a lot of things that we can talk about what we can do, but let us start with talking about simple things that we can do, right? The first thing about mental health is to ensure that our physical health is good, right? A lot of things are in our body are kind of connected, right? If we are physically feeling better, naturally we feel mentally better as well. So I think the first steps to having, to dealing with emotional struggles is to ensure that we take care of our physical health, which could mean, eating right, having a balanced meal, ensuring that we are trying and getting adequate sleep, ensuring that we have some regular physical activity or exercise every day, getting enough sunlight, at least for say 30 to 40 minutes every day, ensuring that we are, taking care of drinking enough water and trying to avoid the use of any recreational drugs, be it smoking or alcohol, and of course trying to de-stress, right? Trying to do something which gives us pleasure. I think that is very important, that we take care of all of this, right? So physical health aspect is very, very important. Now, from a COVID perspective as well, right? Besides the anxiety and fear, there's a um, uh, there's a entity that we call as panic, or panic attacks, or panic disorders, right? What is panic? Panic means a sudden, um, a sense of doom that one gets, where the symptoms can be very physical, where, see, the heart goes fluttering, and you're perspiring, and you feel as if you're going to, uh, you're going to kind of, die. That kind of feeling comes in when somebody is having a panic attack. And panic is usually in the spectrum of anxiety disorders, where panic basically is because it is triggered because of certain recent events, or even remote events that one may have gone through. From a COVID perspective, so if somebody has gone through a difficult time, right? If they have themselves suffered from COVID, or if they have seen somebody who is very close to them and have suffered from COVID, and it has been an extremely difficult journey for them in terms of coming out of COVID as well, it can lead to leaving this sense of heightened anxiety, leading to a panic kind of a state, where they are always, feeling as if there's something going to happen, right? So the anticipatory anxiety itself leads to a lot more, symptom presentation, and it can be quite difficult. I think panic disorders are definitely quite difficult, and people who suffer from it definitely need support. Now, how do this support? How can we provide this support, right? So the first thing is that if you think that you are having a panic attack, or you are having a panic disorder, first is to definitely get it evaluated by talking to a psychiatrist. Now, who are psychiatrists? Psychiatrists are doctors who have a postgraduate degree after, and have studied medicine, and who basically are able to kind of diagnose your condition, right? So first thing is that we need to get this diagnosed, because the moment we get it diagnosed, then there could be therapies and things that can be done to help you better cope with the panic symptoms that you may be having, right? So the first step would be to kind of figure out if we are having a symptom which could be like panic, and then get it diagnosed or assessed correctly first. Then going on to sometimes need for medication to help reduce this heightened anxiety, followed by definitely a big role of psychotherapy, right? Psychotherapy is usually provided by trained clinical psychotherapists or psychologists, right? Psychologists are professionals who provide therapy in a specific way, which is not medication, but it is therapy in which there is a behavioral therapy, there is an emotional therapy that is given to help the person um, equip themselves with coping strategies against any kind of symptom that they may be having, right? So it's important that you kind of get yourself assessed from a psychiatrist, and then definitely seek help from a psychotherapist who would be able to help you with therapeutic techniques to deal with the panic symptoms that you're having. Um, a very common technique that is used by psychotherapists is definitely something called as biofeedback, because once we understand that this is something which is a part of panic attack and not really something which is a physical health, coming from physical health ailment, like it's not that you're feeling as if you're going to get a sudden heart attack, but it's not really that the heart is getting affected, right? So then it is important that the psychotherapist would teach you basically certain techniques in which you would be able to reduce your heart rate, or tell yourself, or it's called talk therapy. You maybe they will teach you how you can talk to yourself so that you can reduce this panic stage, because the panic stage usually breaks after a while. It is that you need to keep telling yourself that this will reduce in a matter of time, right? So, and they usually come as episodes, right? It's not something that is there throughout. There is the anxiety, and then there are these panic attacks which happen in between. So it's important for the person who's suffering to first understand what the diagnosis is, and then be able to do self-talk therapy and certain other therapeutic measures along with biofeedback that the therapist will teach, so that they are able to deal with the panic attack that they may be getting. It is difficult uh, because of the uncertainty of the times around us, right? Because we do not know, people are already thinking about, is a third wave going to come? When is this going to get over? When am I going to get back to a normalcy life? So all these questions on a regular basis tends to kind of put us into a place where we are in heightened anxiety at all times, right? And this leads to panic, generalized anxiety. It can lead to depression and many other things, right? So hopefully that this would help you to seek help. But if you are having panic attacks, it's important that you do seek help. Go to a professional for a proper diagnosis, and get yourself talking to a therapist, because in the long run this will help you to get better and in better control of the panic symptoms that you are getting. Okay. Now, along with this, I think with the unfortunate loss that we have seen at many levels, one big uh, issue or mental health struggle that at least I have seen is dealing with bereavement or dealing with loss. There are a lot of people who have lost near and dear ones. People have lost parents or spouse, or a lot of near and dear ones, be it say colleagues, and this has led to um, uh, you know a lot of people grieving for the loss, right? Now it is difficult, because when we lose someone, it's like a vacuum that is created. And yes, it is not it is not that we can ever fill it, because that place which the person who left us had in our heart and in our minds and in us is always going to be for them in the form of their memories, right? So it is not that a vacuum can be filled. However, what happens with grief therapy, right, where over a period of time there could be a sense of acceptance and then a sense of letting go, that the people who are grieving would be able to get over that vacuum which is created by creating more and more new memories around them, right? By expanding their environment. So I think it's important that if you are grieving, if you've lost a near and dear one, and if you are in a state of bereavement, please seek help from a psychologist and talk about it, because it will help you over a period of time uh, in accepting the loss and being able to widen your horizon, so that you can open up and expand your environment. It is important that you do seek help in cases where you have lost and it is becoming difficult. Please do not um, do not uh, let shove it under the carpet, because loss is absolutely, or grief work, as we say, absolutely needs attention. And do seek help in if you are grieving. It will, in the long run, help you to have a more productive and a good quality life in the years to come. Okay. Now, going back to certain strategies that we can take, right, like which are more from perspective of what we can do in how we can help. So the first thing that I think it's important for us to when I spoke about awareness, right, I think it's important for us to have a very open and honest discussion with people around us, be it loved ones, because or colleagues, or people who matter. um, uh, be it about our own emotional struggles, or be it about some emotional struggle that we seem to be observing in the loved one, right? It is important that we have open and honest discussions, because if we don't do that and we don't open up, it is only going to make you feel more cooped up inside, right? So do talk about it. Now, it could be that you talk about it to your near and dear ones, or you would want to talk it over with a professional, but do it, because it will only help you in the long run, right? Now, when it comes to a loved one, right, a lot of times a loved one may not really express their symptoms, and many a times it could be important that we kind of observe any change in pattern, like I was mentioning earlier. Like maybe if you've seen a loved one with change in sleep patterns, or change in eating pattern, or there could be, say, worsening of health issues, right? Somebody who already has a known chronic disease and it is kind of worsening, or it could be, say, change in their work profile, or change in inability to concentrate at work, or procrastination, right? These are more observable kind of outcomes, and it is important that we if we see this, or maybe say change in the way they use recreational drugs, say increase in use of alcohol or smoke or any other recreational drug, it's important that we observe this. We need to be definitely supportive of our loved ones, but it is important that we acknowledge that something might not be going well with the loved one, and that they might be having certain emotional struggles, and to have that discussion with them, so that you can help them to get that, or seek that, seek uh, kind of a support, be it from you yourself, or from a professional, either which ways. But I think it's important that um, we help our loved ones in this way, right? By being more aware. Now, I think the first step to healing, as I say always, is acknowledgement, right? So it's important that we acknowledge our anxieties, we acknowledge our fears, and we become more aware, and try to, get, say, correct sources of information or what it is. Because a lot of times anxieties and worries can also stem from, say, um, poor quality of information, right? So instead of speculating, or instead of getting into rumors, it's important that we figure out where our information is coming from, right? And then work around it, right? Now, it's important that we take care of ourselves, as I was mentioning about our physical health, right? I think that is really important. And you should follow those 5 6 tenets that I had taken you through. But apart from that, I think one big chunk of, say, emotional struggle that I see in a lot of patients who come to me is definitely people who are having struggle with this work-life balance, right? I'm unsure if many of if this resonates with a lot of you, because with a year and a half, most people have either been working from home. A lot of people may have had the unfortunate incidents that they may have been out of work. And all of this has definitely led to a lot more stressors from mental health perspective, right? People who are working from home tend to have a lot more struggles and issues, where they're trying to balance, their work routine versus, what they can do at home, be it for their family, or be it, in terms of if they are staying alone, the loneliness that it is causing because of poor social interaction, and it has all kind of gotten into a lot more mental struggles that we are seeing, leading to increase in depression and increase in anxiety disorders as well, right? So I think it's important, if you're staying in a family unit and if you are somebody who's working from home, it helps to have open communication, ensuring that you figure out boundaries. There is distribution of work or distribution of you know roles and responsibilities that is given, because then it helps in everybody. It helps in a way that everybody can kind of contribute at the same time, but also works at having open channels of communication. So I think it's important that we take care of this if you are coming from a work from home kind of a situation. Um, I know that a lot of people are struggling with work itself, and I know a lot of people who have gone into depression, with loss of work or loss of employment, and leading to uncertainties. It is important that you do not lose faith and ensure that you keep looking out, right, and seek help in terms of reaching out to people that you know, and asking for help in terms of, say, if you need to get work or whatever kind of work that is suitable according to um, what your role is or what your skill sets are. I think it's important to ask for it and seek help. There are people who are out there ready to help if somebody voices it. So the first step would be to ask for help, because in many cases you will find a lot of people who are ready to give it to you, right? So take care of yourself when we talk of work from home, because there's a huge topic that can be there. When we talk about work from home itself, right from taking care of elderly at home to children at home, in terms of providing for them, but also looking at their mental health, right? So when we look at mental health struggles, we usually talk only about the adults, but there's a huge thing about mental health struggles that children go through, or say older individuals go through. Now, children, we have seen an increased amount of struggles that children are going through, specifically because of poor social interaction. Children are more social; they like to play and meet their friends, and in a physical environment. And unfortunately, this is something that has not been um, children have not been able to do it, and it's been the second year running now that children are still doing, most of them say are doing online classes or deferred. They are getting assignments and they are just finishing it and giving it to their sending it back to their schools, and so on and so forth. So from a when you are talking about mental health and children, it is important for us to understand that children may not be able to verbalize what they're feeling, and a lot of times children show their mental agitation through their behavior. So a lot of children have kind of come up with showing increased agitation, getting overtly angry. Also because a lot more children are now having increased screen time, because they tend to watch more television at home, or they are in front of their screens to do their school, be it on a laptop or any other kind of screen. And it is affecting their health, because physically they are not active. Children need to be physically active, and it's important that we figure out methods to keep them physically active when at home, right? So be it as a parent, you may want to do an exercise routine with your child if the child is old enough, because that helps to not only engage your child, but you yourself would also remain physically active. So I think it's important that we channelize energies in the right direction, by making the children more physically active at home. It's also important that children are given roles and responsibilities at home. Children as old as 5, 6, they can definitely understand roles and responsibilities, and they are, if we entrust them with that, because that also empowers them and makes them understand that they are an important part in the family unit, right? And I think, especially with adolescents, it's important that we have channels of communication open, right? As parents, we also need to be more friends with our adolescent child. And it's important that we have channels of communication open. If you're observing any change in behavior or the way they express their thoughts through the speech, I think it's important that we talk and try and seek help if we find that the child is going through any kind of depression or low moods, anxieties, so that this can be corrected at the earliest, right? So talk it out with your children. Ensure that you're available for your child so that they, as a listening ear. Um, Most of us, as in terms of parenting, we can be judgmental, and especially with adolescent children, I think the one important thing that they look forward to is a non-judgmental listening ear. As a parent, if we can give that to them, many a times they will most of the time they will make the right choices. But of course, we need to be there as parents to help them make and guide them in making the right choices, right? Now, with elderly people also, it has been quite a struggle. A lot of people, because they are mostly cooped up inside their houses, they are not able to go out because of risk of higher complications because of COVID infection itself. And it's and because they are not able to use their time well, we are seeing a lot of older people going into depression. um, it's important that we keep communications virtually available for our parents or older individuals in our family. A lot of people are kind of staying away from home. So if you're somebody who stays in a different city, as opposed to your parents, it's important that you are virtually connected with them uh, regularly, so that they also have a sense of you understand their well-being. They also understand, you also help them to alleviate their anxieties about your health. And also we get a sense of giving them a purpose as to why they are and give them a sense of purpose of what we need from them, right? So I think it's important that we specifically connect virtually with our parents if they're in a different city. If they are staying with you, I think it's important that you also build in roles and responsibilities for them. I think it's important so that they also understand and they also feel that there is a purpose to what am I doing in the house, or my contribution to the household. And it really helps them in the long run. Important that if you have older individuals at home and they are suffering from any chronic diseases, ensure that it is monitored well, they are treated well on optimal medications, and get them to talk to a doctor regularly, because it helps to be physically well, right? So that those follow-ups and constant monitoring are definitely advised for anybody who has got chronic diseases, specifically older individuals, because they would have it more. So you need to also take care of that. Okay. So overall, I think it's important for us to understand that you know um, uh, mental health is definitely something that we need to be aware of. We need to acknowledge it, and then we need to take steps to ensure that we are able to cope with it in the right manner. The pandemic definitely has pushed us in thinking more from a mental health perspective. It has taught us that we need to be more aware of how we feel, and it has also taught us that we need to be empathetic and sensitive towards others' mental health needs as well. So it is my ardent request to all of you that if you see that you are having any mental health struggles, or if you observe somebody in your environment who is having any mental health struggles, please be available for each other and seek help at the right time. Help need not always mean going to a doctor. Help could mean reaching out to a friend, a fellow human being, a relative, a colleague, or someone that you trust. Because many a times, just being able to speak out And just knowing that there is someone out there who is there to listen to you is all that we need. So take care in terms of seeking for that kind of help. If you think that you would, you need more than just talking to a close one, do reach out to a professional, a psychologist or a psychiatrist, who would be able to help assess your issues and give you the right direction as to how we can manage our mental health struggles. Take care of yourself. I think, over a period of time, we all will become more stronger and resilient from a mental health perspective. At the same time, remember that the pandemic is still here. We need to ensure that we all get ourselves vaccinated. We need to ensure we take care of our physical health. And of course, that we follow COVID appropriate behavior at all times so that we can not only protect ourselves, but also protect our loved ones around us. So until next time, stay safe, stay healthy, and get yourself vaccinated. Take care. Bye bye.
Download the MediBuddy app now. Subscribe to our YouTube channel for more updates.